I'm going to share my screen, and while I'm doing that, just wanted to say it's so wonderful to be with you all today and see some familiar faces and names, as well as meet some new folks, at least virtually. So I am hoping that you can all see my presentation. Any thumbs up if it's looking good? Okay, thanks so much for that confirmation. So what I'm here to talk about today is a new effort from CDC in partnership with a lot of folks on a communications campaign for latent TB infection. This may be a departure from some of the things that you may be used to hearing about in TB. It's a pretty new effort, at least at CDC. So the goals of this campaign are to raise awareness of latent TB infection, of the risk of latent TB infection, and the link between latent TB infection and TB disease among communities at risk, as well as their healthcare providers who may be outside of the public health system or may be unfamiliar with some of the newer advances in TB and LTBI. So we want to address misperceptions that people have, decrease stigma of TB, and encourage testing and treatment, especially awareness of treatment of the shorter rifamycin-based regimens, and really encourage healthcare providers to test and treat latent TB infection among populations at risk. So those are the goals of our communications campaign. The campaign is a pretty small campaign, especially from some of the other health communication campaigns you may be more familiar with, like the TIFS campaign for smoking and a lot of the COVID vaccination campaigns. This one is much smaller in scale, and we're almost using it like a demonstration project to see what kind of impact that we're going to have. So based on the resources that we had available, we had to make some choices regarding audience and as well as markets. And markets are areas that we are sharing the campaign in. So our audiences for the purposes of this campaign are people born in the Philippines and people born in Vietnam. We're mostly targeting adults who consume ethnic media, so media that's specifically designed for these communities, occasionally or regularly. We're also hoping to reach healthcare providers, primarily primary care, family, internal medicine, in community health clinics, as well as other healthcare providers in clinics who serve our populations at risk, as noted above. So our proposed areas, we are planning to do some paid media distribution, and I'll get into a little bit more information about what that is, in the Seattle, Washington area, as well as Los Angeles, California. However, some of the campaign materials will be available through larger markets and nationwide or statewide, but all of our campaign materials will be available nationally on the CDC website in English as well as in Vietnamese. So this campaign is available in both languages. And I'll add that we have done a lot of research leading up to this campaign to identify kind of where people had questions, what people knew about latent TB infection, both in the community as well as among healthcare providers. So the campaign concept, the kind of overall theme of the campaign, is called Think, Test, Treat TB. And what the idea of this campaign is to present TB and latent TB infection as another thing that we check in terms of our preventative health care to make sure that we stay healthy and that we can keep our families healthy. So there are lots of things that we do that we go to the doctor for. We get our blood pressure checked, we get checked for diabetes, we get cancer screenings. And checking for TB infection, if you're in a population at risk, is another one of those things. So it's important for both providers and people who are at risk to check the box, to think about the risk factors and talk about if a TB test is recommended, then to test for TB infection, and if that test is positive, to get treatment to prevent TB disease. So I want to show you a little bit of what we call the campaign creative. So these are some of the visuals that we'll be showing as part of the campaign. And I want to start off with our public service announcement. This is pretty short, but the volume is a little low. So you may want to turn up your volume on your computers. And what I'll do is I'll play it and then pause it and restart it.
Hi, Dr. Lopez. My aunt's a
So that's the volume that it's playing at. That's as loud as I can get it on my computer. So I'll start it over again from the beginning.
Hi, Dr. Lopez. My aunt said I should ask about tuberculosis testing. Could I have TB if I don't feel sick?
TB can live in your body for years without symptoms. This is called inactive TB or latent TB infection. That can develop into TB disease, which can make you sick and spread to others. TB hides in plain sight. Millions of Americans don't know they have it.
How can I keep my family safe?
The only way to know is by getting tested. Let's schedule an appointment.
Great. Thanks. Hi, Dr. Lopez.
So that is our public service announcement. And again, it's available in English, as you just saw. We will also have a version available in Vietnamese that has a different cast of people born in Vietnam. So same script, but different cast. We also have a number of print and digital materials, and I'll scroll through those a little bit. You'll see some familiar faces. Our healthcare provider from the public service announcement, as well as some family images. When we talked to community members about what would motivate them to get tested and treated for latent TB infection, the two things that we heard over and over is, I would get tested if it's something my healthcare provider would recommended that I do, and I would get treatment so that I can protect my family and protect myself. So we have some other digital materials, again, that really center on that family message and the trusted healthcare provider message as well. We have social media is a big part of the campaign. So this is a message about TB hiding in plain sight, and this is animated. So the tuberculosis gradually appears with the animation. We also have some digital materials for healthcare providers. When we did our research among healthcare providers and asked them kind of what would motivate them, the things that we heard is that, I really didn't think that I had a role with TB. I thought that was something that just the public health department did. But if I, now that I'm aware that they're, I've got the resources or have the ability with additional diagnostics and shorter regimens to test and treat latent TB infection in my practice, that's something I'm definitely interested in doing. And then we also heard that providers also wanted to know what the situation was in their community, not just nationwide, but to hear some of that local epi data to really get an idea of the percentage of their patient population who may be at risk. In addition, we have developed some educational materials. We've developed a poster for clinics, as well as some conversation guides to help healthcare providers talk to their patients and patients talk to their healthcare providers. Again, these are really designed for patients and providers who may not be as familiar with latent TB infection as I'm sure many of the experts on this call are. So what we had heard from our providers is anything that we can provide to make their jobs easier, to give them some talking points that they can share with their patients would be greatly appreciated. So we developed some of these conversation guides. And then we also have some patient fact sheets that talk about some of the myths around TB testing. As you can imagine, people had a lot of misperceptions around BCG vaccines and the effectiveness of TB tests. And so we wanted to have some materials that explained that as well. These materials will also be available in English and Vietnamese, and we're hoping to get these translated into some other resources as well. They will be available for download on our campaign website once that's live. And also all of the educational materials will also be available to order complimentary through the CDC warehouse once the campaign goes live, and there'll be information about how to do that on the website. So that's kind of our materials that we have. In addition, I wanted to share some of the campaign implementation activities that we're planning. So to reach consumer audiences with this campaign, we're hoping to meet consumers where they are in the neighborhoods and supermarkets and shopping centers and where they spend time every day. So examples of how we're hoping to reach some of our consumer audiences include things like those shopping centers using some static and mobile and digital signage, but we also want to meet people where they are online. So social media, digital ads, YouTube, as well as kind of more traditional media like television, and I've listed a few examples there, as well as print publications. So for Seattle, what does this look like? It looks like some banners in select grocery stores, some LED trucks that are mobile signage so that we're able to kind of drive around in different neighborhoods, some materials in grocery stores, materials outside pharmacies or doctor's offices. And then in Los Angeles, it looks very similar. We have some banners in some supermarkets, some of that mobile signage. There are some supermarkets with some digital screens that we're hoping to take advantage of, as well as some shopping mall signage. So primarily our out-of-home consumer research, it will be concentrated in the Seattle and Los Angeles areas. We're also looking at some print and broadcast and digital media as well. Some of that will be focused primarily in the Seattle market, but others will be more national. So we are purchasing some ad space on the Filipino channel, as well as on Crossings TV, which has a more national reach. We're also working on some digital buys for them to be available primarily again in the Seattle area for our digital buys, with the potential to go a little broader, and that's the same for social media. For our Los Angeles consumer channels, again, looking at that, some of those print outlets in Vietnamese, as well as some of the broader broadcast channels and digital and social media as well, using some of that great creative that we showed previously. To reach our healthcare provider audiences, this is a smaller piece of our campaign, but we are focusing pretty heavily on digital ads on professional journals like the American Academy of Family Physicians, and medical websites like Medscape, as well as purchasing some space on state medical association websites in Washington and California, and using some other provider education channels that CDC has relationships with. So we're hopefully taking advantage of lots of different areas to reach healthcare providers. But particularly for this audience, our partners will be a really important channel. So to give you an idea of when all this is happening, this timeline is changing. It feels like it's changing every day. We've been working on getting the materials developed, and now we're working on kind of some final clearance. So we are in the middle of kind of partner engagement and finalizing a lot of these resources. We're getting our website built. So we are hoping that the campaign will launch in late February, early March, depending on how some of those clearance timelines shake out. As you can imagine, a lot of our development and review at higher levels of CDC and Health and Human Services has been slowed down a little bit due to the COVID-19 pandemic, but we're persevering and hoping to get these materials cleared and developed soon. So our paid media will really, both for healthcare providers and consumers, will really kick in around March in the lead up to World TB Day. And for the most part, go through July and August before closing out in September, which is the end of our contract year for the campaign. So our partners will be a really important part of expanding the campaign, both within and outside all of the target markets. So this is an example of some materials that will be available in the partner toolkit. which will be a part of CDC's campaign website once that's live. So that will have some key messages, social media content, sample content to drop into newsletters or blogs, information about the campaign, and a campaign resources sheet to kind of give folks an idea of everything that is available. And our partners include some of our traditional partners here at CDC. So our TB Centers of Excellence, some of our national partners at NTCA and Stop TB USA, and our Survivor Network through We Are TB, as well as our state and local partners. And we've had a lot of great conversations and meetings with Masa and his team. And really value their insight into how this will best work in the Seattle area. We're also working closely with our TB Elimination Alliance partners to get some insights on some of the needs of some of the health clinics and communities that T works with, but we're also hoping to engage new partners in this campaign, which is a big reason of why I'm hopefully here today to share the information with you all. So we're hoping to share with state and local organizations and medical associations, as well as medical associations and groups that serve the Asian American and Pacific Island communities. And so I know I went through that pretty quickly, but once again, wanted to thank you for the opportunity to share a little bit about the campaign with you all today. And I'm happy to pause and take any questions.